Okay, so now we're going to talk about the lower respiratory. Remember the upper respiratory we covered in the last video, and your upper respiratory is going to be everything from the external nares inside the nasal cavity and all the way to your larynx. And then once you get to your larynx, everything from the larynx inferior is going to be the lower respiratory. So that's where we're going to start now, is talking about the lower respiratory. So let me grab this model here. So right here, you will see in the throat area right here, this is going to be your larynx, okay? And your larynx is going to consist of a flap right here. This flap is called the epiglottis. Remember, epi means sitting upon or sitting above. So your epiglottis, this flap, sits above this opening right here. This opening is called the glottis. So your epiglottis is going to flap closed when you're trying to swallow food or liquid so that you don't get food and liquid down into the lungs. So again, this flap is called the epiglottis, and this opening right here is called the glottis. These two skin flaps right here, these are called your vocal folds. And then in the front side of the larynx, you have this very, very large cartilage called the thyroid cartilage. And then underneath or inferior to that, you have the cricoid cartilage. So epiglottis, this opening is called the glottis. These two flaps are called the vocal folds. This large cartilage right here is called the thyroid cartilage. And then this cartilage right here is called the cricoid cartilage. And then just inferior to the cricoid cartilage right here would begin the trachea. Okay. Okay, so this is going to be the larynx. So this is just the larynx blown up so you can see all the structures a little bit clearer. So again, your larynx is going to be in that upper portion of what you would consider your neck or your throat area right here. Remember, in this area, you have a bone that floats right here, okay, and it's kind of just hanging there. That bone is called your hyoid bone. So this white structure right here, this is going to be your hyoid bone. Then this right here is going to be called the larynx. So everything in here is the larynx. And then sitting inferior to the larynx, this is going to be the trachea. So this top large cartilage here is called your thyroid cartilage, because you can see it sits very close to the thyroid. So again, this large cartilage here is called your thyroid cartilage. This cartilage here is called your cricoid cartilage. And then all of the bands of cartilage underneath or inferior to the cricoid cartilage that's going to be circling that trachea, these are called your tracheal cartilages. So again, here all the way down to your lung is called the trachea. And then the cartilages that surround the trachea are called your tracheal cartilages. In the front of the larynx here, you have a ridge. This ridge is called your laryngeal prominence. So it's going to be in this big thyroid cartilage. It's where the two sides of the thyroid cartilage come together and form this ridge. And again, that ridge is called your laryngeal prominence. Now we're going to turn this model around so you can see the back side. So you're looking from the posterior side now. You can see the flap here. This flap is your epiglottis. So your epiglottis, remember, that's the flap that's going to close over the opening so that you don't have food and liquid going into the lungs. So this flap is called your epiglottis. This hole right here, this hole is called the glottis. Okay, so this hole right here. These two flaps right here, this one and this one, these are called your vocal folds. And then these two fang type cartilages, you'll see they look like little fangs. These are called your arytenoid cartilages. So these are your arytenoid cartilages. Okay. And again, this model is the model of the larynx. Okay, so now we're going to go from the larynx down into the lungs. So what I want you to look at here is you'll see this is the hyoid bone that we just talked about. And then this is the larynx. And then this air tube here is called your trachea. And your trachea is that air pipe that you feel down the front of your throat. And you can put your hand on it and you can feel the vibrations that are producing sound through that trachea and that larynx. So again, this air pipe or windpipe is called the trachea, and you'll see it has bands of tracheal cartilages all along its length. Now, when that trachea splits, the first split here is going to be your right and left primary bronchus. Primary because it's the first split. Okay, and this right and left primary bronchus is going to take that air into the right and left lungs. So the right primary bronchus will take it to the right lung, and the left primary bronchus is going to lead into the left lung. Then when that primary bronchus splits for a second time, you have the secondary bronchi. Okay, so this one is a secondary bronchus, because bronchus is singular, bronchi is plural. So here you have one secondary bronchus, and here you have a second secondary bronchus. Here you'll see this is your primary bronchus here splits into the secondary bronchus and the secondary bronchus here. Then your secondary bronchus will split again into a tertiary bronchus. So here, this is the third split. So this is going to be a tertiary bronchus here. And then up here, you'll see tertiary bronchus here. And your tertiary bronchus are going to lead into these terminal pipes. These terminal pipes are going to be called bronchioles. So all of these around here are going to be your bronchioles. And your bronchioles are going to lead into, so this is a bronchiole here, will lead into a collection of sacs. So this sac is called alveolar sac. And then this collection here is called an alveolar sac. So an alveolar sacs are going to have bundles of air pockets in them. And each of these air pockets or these air bubbles is called an alveoli or an alveolus. Alveolus is singular and alveoli is plural. So again, here you're seeing the bronchioles. Here's the bronchiole blown up, and it's going to lead into one alveolar sac. You can see one here. And then this collection here is called another alveolar sac. And then each alveolar sac is going to have a bubble, and each one of these bubbles is called an alveolus or an alveoli. And in these alveoli, this is where your gas exchange is going to occur. So we've breathed in a bunch of air, and we want that oxygen from the air, and it's going to go through these alveoli and will be absorbed by the blood. And then the blood is going to push out carbon dioxide out of the blood. It will go into these alveoli, and then when we breathe out or expire, then we will push that carbon dioxide waste out of the body. So this is where that gas exchange of oxygen and carbon dioxide is going to be occurring here in these alveoli. Okay. Now we're going to go to the lung itself. So now we're looking at the lungs. Let me see. Okay. So in the lungs, you have an apex and a base, just like we did in the heart. So remember, your apex is the point and the base is the broad side. So this general area right here would be classified as the apex, and this general area here and here would be the base. So the general area here is the apex, and the general area here and here is the base. Okay. This organ is the right lung. This organ is the left lung. And you'll see the lungs are not identical. They're a little bit different. Okay. In this right lung, you'll see that you have 3 lobes. So you have this top lobe here. This is your superior lobe. Then you have the middle lobe. And then here you have the inferior lobe. So in the right lung, you have the superior lobe, middle lobe, and inferior lobe. Now between the superior lobe and this middle lobe, you'll see that you have this cut. This cut is called the horizontal fissure because you can see it lies horizontally. Okay. Separating this middle lobe from this inferior lobe, you'll see you have this cut here. This cut is at a diagonal, so we're going to call this an oblique fissure. If you remember your different planes from AP1, at an angle is called an oblique. So this is your oblique fissure that's going to be separating your inferior from your middle lobe of the right lung. Okay. So again, the horizontal fissure separates the superior from the middle lobe in the right lung, and your oblique fissure is going to separate the middle lobe from the inferior lobe in the right lung. Okay, now in the left lung, we only have two lobes. We have the superior lobe and we have the inferior lobe. So again, in the left lung, we only have two lobes. We have the superior lobe and the inferior lobe, and they're separated by a diagonal fissure. So this one's going to be called an oblique fissure. Okay, so the oblique fissure here in the left lung is going to separate the superior lobe from the inferior lobe. And again, there is no middle lobe. Now you'll see this notch right here in the left lobe. This notch is called the cardiac notch because you'll see it allows for the heart to be placed right here. So this notch is actually a groove that allows the placement of that heart. So this is called the cardiac notch. Okay. Then you'll see that you have this muscle that is on the inferior wall of the lungs. This muscle here is called the diaphragm. So the diaphragm is going to assist in allowing you to take in oxygen and expire oxygen. Okay. Okay, this is the last model that we're going to look at for our lower respiratory system. And you'll see in here, this is going to be your terminal bronchiole. Again, coming down from your branches in your lungs. So at the very end, these will be your terminal bronchioles. Your terminal bronchioles are going to lead into a collection of sacs called your alveolar sacs. So here's one alveolar sac, another alveolar sac, another alveolar sac, another alveolar sac. Here again, another alveolar sac. Okay. Within the alveolar sacs, you're going to have these canals called your alveolar ducts, and your alveolar ducts are going to lead to each one of these individual bubbles called an alveolus. Okay. Here you'll see this alveolar sac is representing the capillaries. So this one is surrounded by your capillaries, and this alveolar sac is showing the elastic bands around this alveolar sac. So again, this alveolar sac is showing the capillaries. This one are showing the fibers, the elastic fibers. Then the back side of this model, these little ones that look like they are spider webbing out, these are going to be your alveolar macrophages. So these alveolar macrophages are going to be responsible for going in and engulfing, like a Pac-Man type action. They're going to be engulfing any foreign particles such as dust, debris, pollen, bacteria or viruses that get down in the bottom part of those lungs, okay, within those alveoli. So again, these are called your alveolar macrophages. Okay, now yeah, thank you though. I don't know why I keep going blank.